As many of you know, we're right in the middle of our flu epidemic. It is, I'm gonna say it's a severe, it's a severe epidemic this year. You know, we have seasonal influenza every year. Some years are pretty mild, some years are moderate, and some years are severe. And I think this year is going to be, number one, it's early in the season. We don't usually see it this early. And number two, we're having a significant number of people who are very ill and who are being hospitalized, and we've had a number of deaths. So in Mason County, we've had 2 reported deaths due to influenza, and both are in persons that have underlying medical conditions. They're the ones that end up getting the most complications from influenza. We get about 2 to 3 reported cases of influenza every week. Influenza is not reportable, so we still get the reports, but it's not reportable. So the 2 to 3 that we get a week is just the tip of the iceberg. It's just somebody decides they're going to report it, and so we just take the report. But we follow the. We don't really do a lot other than our public service announcements to folks about staying home when they're sick, covering their cough, trying to prevent further transmission. It is still not too late to get the influenza vaccine. If you haven't gotten it yet, and you haven't gotten the influenza, it's certainly perfectly good time to go ahead, and I think that influenza vaccine is still readily available. So we would encourage anyone that has not gotten influenza and they've not gotten the vaccine to go ahead and get it. It takes about 2 weeks for the vaccine to really take full effect. For all the people out there who feel like a truck ran over them, please stay home and don't share with others. We also had an issue late last week where our hospital, Mason General, which is a critical access hospital, ended up having to exceed the capacity because they were full. They had no place to put patients. There were too many people who were very sick who needed to be hospitalized. So Mason General works with all the other hospitals within the region, and they pretty much share resources. And this is affecting, the flu epidemic is affecting all of the hospitals in the area. So, so I'll leave it at that. So on top of that, we continue to have whooping cough. So we've had a couple of cases of that reported just in the last few days. We also have Norwalk virus, which is a gastrointestinal illness that continues to make its rounds. A lot of these diseases are fairly commonplace. It becomes a big problem when you have them in a large setting, institutional setting, like a long-term care facility, or in a jail, or in a school. So, you know, a lot of our public health work is trying to decrease transmission in the big settings. So, as always, it's the same advice. You know, if you're sick, stay home. Please stay home. Don't give it to somebody else. We also have a number of rule-out tuberculosis cases that somehow in influenza season they do pop up because people are going in to be seen because they're coughing, and they get the x-ray and then they go, oh, this looks like tuberculosis. So we have not had any that have actually turned out to be tuberculosis, but it does not decrease the amount of work that we have to do for it. So if there's any questions, that's all I have to report.